Okay, anterior cruciate tears. So clinically, that's oftentimes associated with like this feeling or a sensation or even an audible pop that we see in the knee, and this acute swelling that we get, so this hemarthrosis. So what we do is there's a variety of tests we can use on physical exam to help us isolate if that's a tear or not. So there's like an AAPA grind test that you can do. There's the anterior drawer sign that you can do to help isolate that. But this is probably the bestest test.
The bestest.
So we talk about like Lockman or the Lockman's test. So let's watch this video. So you can see the examiner is trying to pull that proximal portion of the tibia, or kind of advancing the proximal tibia, while he stabilizes the distal femur with the other hand. So you can see that whole thing just kind of translating.
That is an abnormal,
That is an abnormal finding. So oftentimes it's described as having a discrete endpoint. This is the way people describe that when you try to do like the Lockman's test with an intact ACL. So here, this person's ACL is torn.
Right.
So you kind of get this no discrete termination.
The way I imagine it is that the ACL is a tether that's supposed to prevent you from anteriorly dislocating.
Right, the normal deal.
But the key is the 30 degrees of held inflection, that you can try to anteriorly translate that. And for me, it was a difficult test because there's really no concept of what do you mean by no discrete endpoint, but really is a feel. Once you feel enough of these exams, especially when you have one person with normal and abnormal ACL that's torn, then you can feel the discrete endpoint versus the other that just kind of just goes. And only the soft tissue surrounding it is holding it back.
Exactly.
Yep.
So there we go. The Lockman test.